when people think of heart issues, most people think of something like a fatality, कि अब तो बचेंगे नहीं. And the first thing that comes into our mind is that heart related issue means heart attack, So is it more layered problem than just thinking that it's going to be a heart attack?
It's largely the question which you asked me is largely deal with the awareness and education of the mass public, and that we as fraternity keep doing on a regular basis. Besides treating patients, the onus of educating society lies on us, and in that process all of us have been regularly doing programs on television or radio and conducting various meetings in a social gathering. And one needs to educate public about the healthy lifestyle, as we normally do. And as you asked, the heart attack or heart failure, the public should know how to distinguish between these two entities. So heart attack, as you know, is an emergency, which would happen if your arteries have blocks and there are plaque ruptures and you have to rush to a hospital for an angioplasty or thrombolysis. Whereas the damage which ensues after the heart attack and leaving the heart weak would lead to eventually heart failure, which is a chronic process. It can last for months and years. And it is there that these patients who have survived heart attack, and which is close to 80% of heart attack patients would survive. It's just minuscule 15-20% people fail to reach a hospital or die at home or in an ambulance. But 80% is a large chunk. And we got to ensure to give them timely treatment so that they don't land up in heart failure and they don't have arrhythmic death thereafter. Dr. Kler is a very big electrophysiological expert, so is Sapra, and I also deal with such patients. So if their ejection fractions drop below a level, then they are susceptible to have sudden cardiac death. It is there that you have to keep these patients under a close scanner, and you've got to see these patients more regularly. And given the current day circumstances where besides the affordability, traveling is not easy. Even people who can afford, people can't easily travel or see their doctor personally. And it is there that the meeting which you have organized here, where I see this AliveCor as one of the sponsors, the role of telemedicine is coming up on the fore. And it was realized truly in last 2 years of pandemic that very sick patients of COVID who were not able to travel and who there was a panic in society that this is the oxygen saturation, this is the blood pressure, what should I do? And we as fraternity were extremely helpful to the public, while we could console them or send them prescriptions and ask them to stay at home. Because even in COVID, just about 5% patients would need to rush to the hospital, 90% patient would just recover at home. And there it worked. So similarly, since all of us are cardiologists sitting here, the role of this modality has been brought to fore in a very, very big way. And I would love to listen a lot about it in the ensuing discussions with other experts, that how far they have been exploiting this technology and how far they have helped their patient by virtue of reaching to them without having a physical visit. So these are the two aspects of your question as I answered.